wanted to kind of speak about how this all kind of started and kind of where we are now. So to start out, the cuts to the interim federal health program occurred in 2012. I was in grade 12. I was actually writing my diplomas when this came up, and I was reading the newspaper, and I saw a headline that said, "Doctors worried about cuts to refugee healthcare." Now, I'm a Somali refugee. I came to Canada in 1997, so I was shocked that the government would cut a program that helped my family when we were here. And everyone has one thing they'll protest about, and for me, this became that thing. So I got politically involved in everything. I messaged the organizers. I got involved planning the first day of action. It was at Canada Place, and that day I actually had an English diploma, and I quickly, how you have like the 1 hour minimum you have to stay in the room? So I quickly finished in that 1 hour, buzzed over to Canada Place, and I went to the protest. It was eye-opening. There was a lot of people there, a lot of people who cared about the issue, and it was eye-opening that the federal government kind of stuck to their messaging and refused to kind of acknowledge what all the doctors and all the activists were doing. So that really surprised me. A few months after that first day of action, the government still didn't respond to requests to meet with the organization or anything. But what happened was we got an email saying that the Minister of Immigration, Jason Kenney, the guy who cut the program, was coming to Edmonton. So seeing an opportunity and being an idealistic 17-year-old, I decided to put on a suit, a tie. I didn't know how to tie a tie that well, but I tried. I walked into the event he was hosting. I waited for him to speak, and I stood up and I asked him a question. What happened was I got arrested. 4 guys grabbed me, dragged me out of the event, and they said I assaulted one of the people. But thankfully we had video that showed I didn't do any of that. So after 2 hours, I was let go. But what happened afterwards was we got all this media attention about the issue. I went on national TV and stuff as like 17-year-old who didn't really know what he was doing. And we spoke about the cuts and we got a lot of good coverage. But beyond that, we really thought that we would get good dialogue on this issue and the government would eventually reverse the cuts, but they didn't. So we planned a second day of action, and then we planned a third day of action, and now we're here at our 4th day of action. And between 1 to 4, a lot of things have happened. I'm now entering my 4th year of university, which is kind of crazy. The provinces, a lot of provinces like Saskatchewan, Quebec, Manitoba have called on the government to reverse the cuts, and also the Federal Court of Canada has ruled the cuts cruel and unusual treatment. And the federal government is still sticking to their line, and they're still not restoring coverage to refugees. So now we're here at our 4th day of action. It's happening all across Canada, and we're just calling on the government, same message, restore the interim federal health program.
Well, thank you very much for the invitation. I'm very pleased to be here on behalf of the Alberta Medical Association. The AMA has supported the National Day of Action for Refugee Health since it began in 2012. This is an issue of doing what is right for individuals and patients. Failing to provide appropriate care for people arriving in this country and awaiting refugee status makes little sense from a health system perspective. Refugees who delay seeking medical treatment because they cannot pay for it become more acutely ill and require more intensive treatment at a higher cost, with longer hospital stays when they do arrive in the emergency department. A Toronto Star story just over a year ago reported that admission rates for refugee children at Sick Kids Hospital in Toronto doubled in the first 6 months after Ottawa cut its coverage for asylum seekers. And neglected health problems cost more to treat, so Canadian taxpayers may pay more than they would have saved by cuts to the refugee program. Here in Alberta, the provincial government has done more for refugee claimants than many of our neighbours and should be commended, providing some of the lost prescription drug and childcare support that has been needed. I encourage our new government to continue to provide this support, but the ultimate responsibility must be on the decision makers in Ottawa. Our federal government must do what is right for these vulnerable individuals who have made safe landing on our shores. We call on the government to develop a rapid process to adjudicate refugee claims, and on a permanent basis provide health benefits to all refugees, especially pregnant women and children. Thank you for the opportunity to be here.
So I'm here involved in this for several reasons. First of all, I look after lots of patients who are refugees in the HIV program and in other areas of infectious diseases where I work. Secondly, I've been to a number of the countries, spent time and worked in a number of the countries that are sources of refugees to Canada, including South Sudan and Zimbabwe. So I have a kind of intestinal feeling for what they've been through to get to Canada. And in fact, on a very personal level, my wife's parents were refugees taken in by Canada at the end of the Second World War from the devastation of Europe. They were from Latvia. So, but I think the most important reason I'm here is, as a Canadian citizen, I am ashamed of the policies, the recent policy changes, in particular the cuts to interim federal health programs. Canada, aside from the Indigenous people who were I guess the first people in the core of Canadian society, the rest of Canadians we're all immigrants. Canada's a country of immigrants. It's one of the best things about Canada. We have the highest, or nearly the highest, proportion of immigrants of foreign-born people among Canadian population compared to just about any other country in the world. Much higher, for example, than the United States. And in general, Canada has had a positive attitude towards immigrants, both historically and in terms of surveys of Canadians about their attitude to immigrants, compared to what's going on in the UK and France and the United States, where they're building a wall on their southern border. We've had a very much better attitude, public and political, to our refugees and immigrants. So mostly, historically, we've done pretty well at this. So it's particularly sad that we should be doing worse. Refugees who've come to Canada have been through some really awful conditions. They've come from some of the worst places in the world. And even when they arrive in Canada, their problems aren't over. They continue to face some real difficulties, of course, psychological and cultural challenges, but even financial challenges. Many refugees are dependent on the food bank, and as I'm not sure if everyone knows, the rules still require that refugees pay their airfare back after they've just kind of got their feet on the ground for a year in Canada. They are at risk for a number of health problems, direct effects of war, such as injuries, certainly diseases of poverty, such as tuberculosis, diseases that anyone could get but that have been neglected because of lack of access to health care, such as high blood pressure, cervical cancer. Many refugees from some of these countries had actually never seen a doctor until they went through their Canadian immigration process. So we could be doing better at supporting immigrants and refugees to become happy and productive Canadian citizens. It's shocking to think that we might be moving in the opposite direction and adding insecurity about health to the other problems that immigrants and refugees face. These cuts are mean-spirited, they're short-sighted, as Dr. Johnson has mentioned, they are going to increase costs in the longer run. And of course, they're costs that are downloaded from the federal government to provincial levels of government. And in the end, they're just un-Canadian. The whole situation is complicated by the opaque rules that are created, different categories of refugees and different categories of diseases that may or may not be covered. So in a way, I am somewhat fortunate, or my patients are somewhat fortunate in that diseases that are perceived to be diseases of public health importance to Canadians are treated differently than other health problems like pregnancy, like diabetes, as we were just talking about before this session started, or trauma. So if that tree had fallen on you, you'd be out of luck in so many ways. So we can't. Canada's not going to solve all the world's problems by taking in everybody as refugees. We do need to have more enlightened and constructive international policies to address the issues that have driven refugees to come to Europe and to Canada in the first place. But we desperately need to have policies that are fair, that are just, that are transparent, and that are humane when people arrive in Canada, and surely that has to include basic health care.
I'll just say right away that I am not a politician, I am not a healthcare specialist, I am a human being. Strip us all of our titles and we are nothing more than human beings. One thing that we've forgotten, honestly, is that we are human beings. Things like this that are occurring is because people are forgetting they are human beings. Now, one thing I do honestly often is I do poetry, and poetry for me is a way to heal. I wasn't born in Canada, I was born in Somalia, and then I moved to Italy. And while I was in Italy, I was at a boarding school that was Catholic. I'm a Muslim. It didn't work out. I got beat often because I didn't want to eat pork. And I found out at an early age the differences between people, skin color, religions, ethnicities, and I had to learn it really fast. And I learned it through hatred. And me, I'm not a person who deals with hatred. Once I receive hatred, I don't deal with it through hatred. I learn how to evolve that into positivity. There's been a lot of times where people have removed opportunity from me or excused me from any type of success because of who I was. Now, I'm not going to take them and be upset at them because people aren't against you, they're selfish. Often these politicians that are making these rules are for themselves, they're not even considering other people. I guarantee you that if you put these politicians in the same position as these refugees, things would change really fast. Unfortunately, there's too much comfort. There's too much comfort in the system. They have a politically set, so they don't even have to worry about this. And that offends me, because even right now, there's a second-class citizenship that's happening. So as a person who's considered third world country, moves from my country because of wars that happen, because of influence from other countries, when I come to this country now and I want to have a better life for myself, I have to be reminded that I'm a second-class citizen. Why is that? What is the necessity behind that? Yet again, it falls into power again. These politicians have lost. They forget honestly that they came fresh off the boat. They were the #1 refugees that came to this country. They're the ones that needed all the healthcare reforms and everything. But you know what's the difference is? They came here first, and they think they can rule everything, and they think they got everything in position. And the problem that we have as human beings right now is we're not unified enough. The second part of community is unity, and we've lost that. Nobody is with each other no more until it happens to us. But when it happens to us, it's too damn late. It's already done for. We can't do nothing anymore. It's over. And so me, I get frustrated because dealing with politics is really difficult for me. That's what I went to school for, just so I can get a grasp of what the hell is going on in the policy world. But it's not for me. I'm a human being, I'm empathetic, and I love to heal people. So my policies is creating art, and my human services is arts, and servicing people through common understanding. So I'm going to share a couple of poems with you guys, because that's my expertise, and I love to heal people. So if you're ever interested in sharing your poetry to heal, to understand, come to Rouge Lounge 117 in Jasper. We're there every single Tuesday. And so the often problem is, people ask me where I came from, and that's offensive, because that's to state that you didn't come from somewhere as well. First Nations are the only people that this is their land, believe it or not. So everybody else came from somewhere else. So to ask me where I came from is you're trying to label me again. And that's another thing is, we're labeled either black, white, Muslim, Christian, Jews. It's all these different things. We can't just be a human being anymore. We're labeled all these different things. And so I wrote this poem, and I got really tired of people because I'm not about fighting people, I'm about raising points, so I wrote them this poem. They asked me where I came from. I told them my mother's womb. The conception of my greatness for some is too much, but the birth of my artistry is a must. That's why there was never a plan B. But if they're dying to know, I was born in a land where the bullets fly free like the doves do, but regardless of how many beatings you get, your mama still loves you. A place where there are more stray bullets than cats, more kufis than hats, and if you don't have that lettuce, cheese, or bread, regardless if you got that beef, it's considered a rap. See, I've been chasing talent with success for many years and I've been abusing it too. So if you were to call me a famaholic, man, it'd be absolutely true. Because most days I wake up wishing I had millions. Others, I'm grateful I'm up and up. But don't get it twisted. I still wish I had the Starbucks so I could live a grande and never be short on money and I'd always stack it tall. Because money is dear to me. I've been chasing dough ever since I was a young buck. My philosophy is much more simple. Plant flowers wherever you go to grow. Remember that the future is in the youth. Power is in the hands of the people. Live to die old, but always fight to be equal. And if your lover asks for space, return with the universe in its place. A bouquet of galaxies and radar stars to light their ceilings at night. And if they act up, cut them from the script, because life is nothing but a sitcom. Some are there for a few seasons, a few are there for some episodes, and most are just extras in the background. And stay clear of those who hijack style, because theirs is too plain like 9/11, or the ones that stand at the corner of the block 24/7 like 7-Eleven. See, I used to have friends that behaved like pennies, and I was having none of it. They didn't change, so I got rid of them like the Canadian government. But I pray that I never forget that it's the light that creates the shadows, and that even stars need darkness to shine, and that we are nothing more than matter made of earth and time. And in a matter of time, this body of ours will go back to earth and won't matter. Because in a world where a legacy is the only thing you can leave behind, it's not when you enter your grave, but when the last memory of you fades that you die. After all, there's a reason why God shaped this earth like a honeycomb. It's so that we may never forget to just be. And I personally think we've forgotten to just be. Everybody is trying to succeed, but they're doing it at another person's expense. It doesn't have to work like that. We are symbiotic creatures. We need one another, believe it or not. Nobody is ever successful individually. There is a team behind them all the time. I went into CBC radio, and I always used to hear that this is outside of the poem. I went to CBC radio. You guys are probably like still wondering. The poem happened at just, and I did it. So I went to CBC radio, right? And I just didn't want an applause because it's more of a topic than actually a performance. So I went to CBC radio, and as an immigrant, you hear the radio, you see all this stuff, you're like, oh my God, fantastic. But when I went into CBC, I saw the person that was talking on the microphone wasn't doing anything but talking on the microphone. There were so many people behind them that were doing everything. There was a person that was mixing the volumes. There was another individual that was making out the calls. There was one that was talking to the radio person, saying, is everything okay? This person's coming up. And I said, wow, that's how society works. In reality, it's exactly the same. Everybody has a team behind them. Nobody makes it somewhere without other people. So now what I'm saying is, what I'm trying to get at is, we are making these politicians who we are. We vote them in. We give them the power. When we're silenced, we allow them to speak. By not speaking up, it's the same thing as being quiet. It's the same thing as telling them it's okay. It is not okay. Because the more this continues, the more it's happening. Bill C-51, C-24, this is never ending. It's not going to stop until we stop it. And I'm really glad there's people like Janice that are around that are actually going to take the time to listen, because I did speak with Janice before. And it's personable, and I like that. I don't want to feel like I have to come up to you like, Emily, oh, you're honorable, yada, yada. You're a human being. Understand me. You came from the same place I came from. You go to the bathroom just as often as I do. Who's to say that you're better than me? But we've allowed these people to think they're better than us. They're not better than us. And they do not think for us. So I'm tired of allowing people to think for us. We need to stand up. That's all we need to do. We honestly need to unite and stand up. I know it seems very difficult, but I came from a house made out of cow shit and sticks. I'm in front of you today. My full-time job is being a poet. English is my third language. Anything is possible in this world, but we give in too easy. We feel it's not possible. We feel we can't make it that far. That's bull. We can do anything we want, but we've given up. We've lost hope. And that's the worst thing in society, is when people feel like they have no more control over something. We do. Have you guys ever seen that political cartoon where Stephen Harper is talking and he's on a cliff and there's a board that he's standing on, there's a bunch of people standing on that board helping him stand still, but if we were all to be moved, he would fall down the cliff? That's the exact same thing politicians are to me. We allow them, we empower them, we give them that power. So I'm going to share another poem with you guys because I am Muslim lately. The government has been doing a really good job at vilifying Somali people and calling us terrorists. When in actuality, I'm just trying to live like everybody else. You know what I mean? The exact thing we're doing, the removing healthcare from refugees, is the exact same thing. They're making these people into villains. They're human beings who need that. It's to say that, well, the only time we will give you any healthcare is when we're concerned about our own healthcare. Get the hell out of here. That's a very selfish perspective. Why can't you be treated for diabetes? Oh, because it doesn't affect you as well. It doesn't. I can't make you get it. Yeah, it's honest to God. It's mind blowing to me that we've even allowed it to go this far. So I'm going to share a poem with you guys because my name is Ahmed Nomadic, and I'll tell you where I come from, and I'll give you a little history. I was born November 28, 1984. It was a Wednesday. A sign my mother says I was destined to hold the week together, but she told me to never become complacent because success, she says, comes in Friday casual and never came in Monday blues. Now, the moment I was born, my mother proclaimed me Ahmed, an Arabic name which is supposed to mean one who constantly thanks God. But ever since 9/11, it means sketchy welfare, scamming, immigrant, terror, pirates. And you know what? That's it. Everybody, right now, give me your attention. Right now, I have lessons and mass instructions, and I'm ready to blow all of y'all away with my talent. Because truthfully, I'm just an African trying to make it in this entertainment industry. Man, I barely blow things out of proportion. But let's take in a moment of silence how I can no longer take my career to the United States to blow up, how I'm unable to break into markets without being detained, how I can no longer hold your attention hostage without raising suspicion. Now, I know the name Ahmed doesn't encompass my history, and that is why I have adopted the name nomadic to carry my Somali tradition. It means knowledge-based nomad, because one of my grandfathers was a farmer, the other a nomad herding animals. I can be needed in the city, so I have adapted to planting ideas that feed thoughts and harvesting emotions while traveling and making a living off of words that are heard. Now, my mother, she jokes that even my spirit is a nomad and that my poems are much like a caravan, because she said even my words are moving. But the thing is, growing up, we couldn't afford toys. So I replaced them with endless amount of stories. And because we had nothing else, I played with monster truck metaphors and action hero alliterations and linguistic spars with my friends and family, facilitated to further perfect my powerful punchlines. But it was my mother's gentle intellect that eased the understanding of how raising points is far more superior than raising fists, and that money has nothing to do with the process of becoming enriched. So now, I invest my time in people. And my grandparents may no longer be here, but I'll continue to embody the dreams. That means even if I had to enter the pen to start a sentence, I would write my way back into the world to finish the poem my grandfathers had started. So here I am, a nomad on a journey, trying not to settle with names like pirate, warlord, or terrorist. And it's obvious that my history is too rich for those poor in judgment. They're unable to digest my truth, so they throw up all these slurs. And I honestly thought it would change with age, but I had to take my expectations to rehab because they were too damn high. And even though I try to sober them with thoughts, they continue to take shots. Now me, I may not be the king of beers, but I'm wiser, so I'll stick to my round of applause, because there's anything I've learned in these 30 years of life, is that it's all about outlook. So word to Microsoft, I'm going to continue to excel until I reach my PowerPoint. Thank you. So I just want to say thank you very much. I really appreciate it. Honestly, anything is possible. We just need to unite and stand together. As long as we continue to do this, the movement should continue to strengthen, and it will. I'm very happy, and trust me, on my own level, through arts, I will penetrate the healthcare system and policies, because there's too many politicians speaking for us these days, and we need to stand up for ourselves. Thank you very much.
Bashir, and thank you to all the organizers for putting on this event. As Bashir said, I am running to be the Member of Parliament in Edmonton, Griesbach, and I'm here on behalf of Linda Duncan, who is of course in Ottawa today, and the NPP as well. I think, you know, it's not a good feeling to be ashamed of one's country, but I must say that on this issue, it's pretty hard not to be ashamed of this government. And a government that just can't seem to stop playing politics with people's lives. We know that the Federal Court of Appeal has recognized the harm that this government is causing to refugees, joining refugee advocates, doctors, provincial governments, parliamentarians, and many Canadians in standing up against these cruel and unusual cuts. Judge McTavish actually noted that these cuts jeopardize the health and indeed the very lives of these innocent and vulnerable children in a manner that shocks the conscience and outrages Canadian standards of decency. So, you know, it doesn't seem to matter to the Conservatives that taking care of one another is a basic Canadian value. It doesn't seem to matter that the rights and freedoms guaranteed in our charter are being violated. It doesn't seem to matter that people are suffering without even getting access to medications they need to control chronic medications, or chronic conditions, pardon me. It's time to show the government that these issues do matter. and that people matter. It's time for this government to quit playing politics with people's lives and restore the interim federal health program as it existed previously in 2012. Because I want a country, I want a Canada that we can be proud of, and that Canada, you know, a Canada that leaves no one behind and considers no one to be a lesser person, unworthy of basic human rights like health care. So please, I urge all of you to continue to have your voices heard on this issue. We know that we can and that we need to, we must do better. So thank you again for being here, and again, thank you for all your advocacy.
But I guess to conclude, I remember when the cuts were first announced, it felt really hopeless going up against this big, you know, like giant government and being, you know, just people, human beings, as Ahmed said. But victory after victory has shown that we can make progress. And I guess the one thing I kind of want to leave everyone with is, if not us, then who? And if not now, then when? Let's keep putting pressure on the federal government. Hopefully we don't want to be back here for 5th day of action. So beyond that, I would welcome you to mingle. I know you guys are on your lunch break and everything, but, you know, write a little message on the postcards and let's keep fighting. Thank you.